Good afternoon, good evening to everyone again. So welcome again to our discussion of our course, Pathophysiology. We have started already the introduction to the pathophysiology, and last time we had our presentation of the course description. We have defined accordingly pathology. So as reviewed, the pathology is the study of the disease process. And we have also reiterated during the time on the discussion of the course description that uh, population groups or age groups across the lifespan may have different response to diseases. So that's why it's very important for a nurse to specifically know the foundations of the assessment and physical examination so that to facilitate our findings if we will immediately attend to our clients with urgencies, because there are some situations that we really need to consider immediate response because this could be high risk for fatality or possibly may lead to death. We have also discussed as part of our pathophysiology is our overview of the importance of knowing etiology, signs, and symptoms. We have discussed last time that the signs have been considered as data that is very important for a nurse to facilitate direction of care management. So signs could be, as obviously, vital signs, results of diagnostic exams, and results of physical examinations, while we have considered the symptoms as the subjective data from the client themselves. And pertaining to the course outcomes, we have identified also that it is very important to know if the person had been diagnosed, then we need to track specifically the causes. It is very important because we have been oriented in the healthcare delivery system of promotive, preventive, curative, and rehabilitative. So eventually, if the client needs to have treatment regimen, then most probably the client have experienced disequilibrium, and you have been introduced to a process of equilibrium. And once the client may experience a problem with health continuum, then these are considerations that the client may have deviations or physiologic dysfunctions that the body is not responding anymore normally. So those risk factors that we have considered, as we defined before, is we had the modifiable and the non-modifiable risk factors. So we have mentioned last time that the modifiable risk factors are factors or risk factors that can be changed. So those examples are lifestyle, nutritional management, some of the concerns that affects specifically everyday life. Now, when it comes to the non-modifiable risk factors, so we have identified that these are the factors or risk factors that can't be changed. And these are constant, such as the age, the gender. So we have also identified the implications of knowing the directions of appropriate management. And one of which that we have identified is the basic understanding of concepts and elements of disease. During those time, we have identified the difference between the anatomy and physiology. So later on, as we discuss the system, we could identify what are the organs that compose each system, and in general, what are the functions that make the system function physiologically in our body. And it is also very important. We have considered also the relationship of one organ to another organ. So the typical examples that we have mentioned last time is in particular that if there's a problem with hypertension, then obviously we can identify that the regulation of the blood pressure is primarily the role of the heart. So to stabilize the problem with the hypertension, so what organ specifically, as I always reiterate, to compensate and basically stabilize the blood pressure. So we have the kidneys. So if the kidneys may have a problem, obviously it may take also a concern in connection with the heart problem. So in vice versa, on the other hand, if there is a problem with the heart, so obviously it may affect the kidney. There are some situations also that we connect a situation that when the problem occurs to a patient who may have diabetes, so we have association when it comes to the level of blood sugar, and with the level of blood sugar, so we consider the sugar or the glucose breakdown, which is eventually important with the hormone insulin, which is produced by the islets of Langerhans and at the same time by the pancreas. So if the pancreas is having a problem specifically with the production of insulin, then this will cause a problem when it comes to the increased blood sugar. And once it will cause the increased blood sugar from term itself blood, it may cause a direct effect to the blood vessels. And since the blood vessels are distributed all over the body, it may cause the possibility of multiple organ dysfunctions because if the blood vessels are involved already, this may cause a problem with the brain, obviously. This may cause also a problem with other major organs such as the kidneys and other organs which is very essential when it comes to the physiologic functions or survival of the person. Number four, we have identified also the importance of knowing the basic diagnostic examination. We have already defined or have already identified an example which is the what we call diagnostic examination, such as the complete blood count. So we have identified if you are aware of the interpretation of the complete blood count, such as if it is above RBC, we have polycythemia. If it is below RBC, it is anemia. So this is somehow related to the perspective of the volume of the blood. We have identified if there is anemia, there is hypovolemia, and if the client may have polycythemia, the client may have hypervolemia. And I even also ask a question, which of the two situations may need blood transfusion? So we have discussed and mentioned about that a person who are anemic and may have hypovolemia may lead to a possible blood transfusion because eventually it affects the volume. So another is we have also identified in the CBC the action of the white blood cell. And if you want to distinguish specifically the difference between the viral and the bacterial, we need to identify in the differential count to specifically identify if it is bacterial or viral infection. On that note, that also corresponds with the other course outcomes that I have identified, that the implication of knowing these results or interpretation may clearly direct on what would be the appropriate treatment regimen. That's why in number 5, we're considering the pharmacological management. So if the nurse is capable, has the competencies to specifically interpret diagnostic examination, they will be geared to appropriate care management and intervention, which obviously, if the client had been identified with elevation of WBC, then the client may have a problem with lymphocytes, so it's viral. So it may have the antiviral drugs or pharmacological management. And on the other hand, if the client had been identified with elevation of WBC, then we could see that the client may have the bacterial infection if there's elevation of segmenters. So that will be on the succeeding lessons that we will discuss. And it is very important for us nurses to identify normal values and most specifically the interpretation on what could be the implications to pharmacological and treatment regimen. So we have also discussed the definition of physiology, and we have identified that the physiology is related to normal function. So if, for example, if the person is on the state of equilibrium, it means that you are in a state of normal function. If ever there are signs and symptoms that you have been that you have identified, so these are the body's processes which may alert the person that he or she is not anymore in the normal function. So that's why we need to be to attend those situations because it is not the normal response of the body. So what would be the possible information that we may have if there are some problems with the signs and symptoms? It means that there is a problem with the deviation already, and that is one that we may consider if we will identify specifically the manifestation in relation to the disease process, which in this physiology, we have identified the processes and functions of the body. So most that we consider that every organ and system has functions. And we have defined also and classified the different specialties. So for different specialties, we have the cell physiology. So for cell physiology, this corresponds with the study of cell. From the time that we have discussed about the cellular functioning, it always consider po the point that every time that the cells are affected, when it comes to oxygenation, when it comes to nutrients, where do the cells gather or sustain yung the needs for them to have an intact activity? So in the circulating blood, because in the circulating blood, the plasma definitely carries those waste products and the nutrients for the metabolic activities of cells. For the oxygenation, it came from the hemoglobin. So if the cells will be deprived from oxygenation, it will affect but the cellular activity. Yes, there is a direct relationship if the cells are deprived from oxygenation. So aside from that, aside from the metabolic activities, in the cell physiology, it also it studies also in particular the structure and characteristics of the cell. So that's why if there are situations on the capacity by which we could identify malignancy and benign cells, those cells are having their distinct characteristics, and if this will be evaluated microscopically, this will identify specific problems if the characteristics of the cells in that particular organ or tissues are different from what had been identified. If we say special physiology, this is the study of the specific organ. So I have emphasized to you and reiterated to all of you the connection between those organs when it comes to the functions by which an organ is connected, if it will consider how these organs also compensate. So if for example, as what I have told you, we will have another example. For example, the connection between the gallbladder and the liver. So if for example, if in your blood we have increase in the level of the cholesterol, the excess cholesterol can be synthesized and stored through the gallbladder, by which this stored cholesterol that are in the gallbladder will be synthesized by the liver. So that's why if what could be the connection with that? For example, I can relate to myself. I open up with you that I do not have any more gallbladder. So eventually, I do not have any more a gallbladder, then what will happen to the supposedly food intake that I may have that is high in cholesterol? So I don't have any more storage of cholesterol. So that's why I need to manage my nutritional regimen to have low cholesterol food. However, since we don't have the cholesterol and the liver is supposed to be the one that compensates on the synthesis of cholesterol, can I be at risk of fatty liver? Yes, because supposedly the liver and the gallbladder is connected with each other with the synthesis of cholesterol. So most who undergone the cholecystectomy, eventually that is what we call the removal of the gallbladder. Most of us, I include myself, most of us are high risk already of the what we call fatty liver. So eventually, are there any other organs that may facilitate the removal of the excess cholesterol? Alam po natin when the liver detoxify, it's either two-way process. If the liver will detoxify the excess cholesterol, it will pass through the urine or pass through the intestinal tract. So it's through the intestinal tract. Kaya it's very important po that the liver must also have an intact relationship to the intestines so that to facilitate removal of excess cholesterol which is not needed by the body. We have also identified before in the pharmacology, di ba, that there are some drugs that are removed is excess properties via the urine, and the others can be removed via the intestinal tract. So alin yung mga nire-remove ng via intestinal tract? Yung mga drugs that may have the iron. Kaya that's why most of the individuals who are taking the iron-based drug may have dark-colored stool. While for the others who are taking the multivitamins, the liver detoxifies the removal of the excess properties via urine, which evidently may evaluate the urine as almost colored yellow urine. We have also identified systemic physiology. If we say systemic physiology, this may involve specifically set of organs that are connected with each other and produce organs that compose to one system. Example, if if the client experiences stroke or tinatawag or on the medical term we have cerebrovascular accident. If the client may have cerebrovascular accident, from the term itself cerebrovascular, it means it may involve the brain and it involves vascular blood vessels. So what could be the knowledge of the nurse in the study of systemic physiology? Since most of the stroke patients are affected when it comes to the brain function, what should be evaluated? It must evaluate the brain itself and it must evaluate also the blood vessels because these are the two that is significant with the development of diagnosis of the what we call cerebrovascular accident. Next, if we will try to relate it to the OB, if the patient experiences the what we call abortion or yung tinatawag nating mga situations that causes the profuse bleeding during pregnancy because this could be connected eventually to the function of the uterus. So if the function of the uterus when it comes to the muscle, so we will connect that the uterus and the muscle, if it will cause contraction, then this may cause the what we call the preterm labor, and eventually the bleeding itself is caused through that problem with the preterm labor. So it connects to the primarily to the basic structure of the anatomy. Then we could lead to the specific direction of what is the effect when it comes to bleeding, what is the effect to the contraction of the muscles, and so on and so forth. Now, we have discussed also pathological physiology. In pathological physiology, it composed of the study of the cell, the tissue, the organ, and the system, and in relation to the disease process. So that's why, as what I've told you, if the client experiences cerebrovascular accident, I can already identify that I need to assess the function of the brain, the function of the blood vessels, so which are connected with the nervous system. Okay, so are there any focus that we will consider in pathological physiology? If there are signs and symptoms affecting the brain, obviously consciousness. Okay? Kaya that's why, di ba, most of the patients who are experiencing problem with level of consciousness and specifically who may have less response, they're the ones who may be subject for what? Cardiopulmonary resuscitation. So it means that there are parts of the organ, parts of the body, specifically organs that are not functioning and deprive the brain from the blood supply and oxygenation. We have also discussed the six structural and functional organization of the body. For the six structural and functional organization of the body, it always starts with the chemical level. The chemical level that we have identified are the molecules, the atoms, the proteins. That's why every time that we discuss every time that we discuss in the pharmacology, it always connects with the protein filaments, it connects with the mitochondria, it connects with the cellular activity. But before we proceed to those cellular activity, tissue damages, we come to a point of how the cell leads to its activity. So with our orientation, a cell has a basic unit of molecules and atoms. And the molecules and atoms can be also related to the electrical charges. Di ba, I have mentioned before sa inyo that when it's during the relationship of concept of the systole and the diastole, this is the time that when the heart is on the relaxation phase and when the heart is on the active phase of contraction. So it's very obvious that the cells becomes more positive and the cells becomes more negative during the relaxation phase. And that will be answered on the response of the electrical charges brought about by the action of the atoms, brought about by the action of the molecules, brought about by the action of the electrical charges by which the cells may function. So on the other hand, we have the cellular level. So if the cells composed of molecules and atoms to have its cellular activity, the smallest unit or the basic unit of the body may identify is the cellular level. That's why from the cell itself, ito ano na lang, consideration with the pregnancy, di ba? When two cells meet each other, the sperm and the egg cell, it may form a specific organelle. So how it happened? Since these cells are capable of having union so that to produce a zygote, then this may lead to the possibility of forming the organelle. So that's the start. So we could understand that from the time that the person becomes a zygote and becomes an embryo, it will lead to the possibility of development of the embryo. So this is a process. The cells are connected with each other on how it formed. Kaya that's why po, as what I have told you, that the brain may have a distinct type of cells. We have endothelial cells per brain. For the lungs, we have epithelial cells. For stomach, we have epithelial cells. So that's why it is very important for us to be knowledgeable of these types of cells, because this could be very important when there will be microscopic evaluation. So we have a question. Din, hindi pa po na-discuss? Okay, sige. Okay. So I'm starting na for the discussion. Thank you so much for the reminder. So when it comes to the six structural and functional organization of the body, so I'm starting to have the discussion and transition of the topic, because later on we'll have the self-assessment exercise. So thank you for the reminder. Now we have the cellular level. So on the cellular level, the cells, once it will be clustered, it will be lead to the next level, which is the tissue. Pero eventually, sabi nga natin, we have to consider that cell will survive if we have sufficient supply of nutrients, if the waste products are being released out of the body because it may cause toxin to the cells, if the cells are receiving sufficient oxygenation. So once these needs of the cell are affected, oxygen, nutrients, waste products are not removed by the cells, it will cause a possibility of the disorganization of the number one, which is the chemical level. It will not give the impulse for the cell to function to what is intended for. So that's why when we talk about the cellular level, we always take into consideration that continuous deprivation of oxygen may lead to hypoxia. Hypoxia is the term of deprivation of oxygen, and that is very critical. That is very critical. That's why it's very important when you encounter during the times of COVID-19 infection, you need to have the oxygen saturation be checked by pulse oximeter, because that may give you the idea if the circulating blood carries enough oxygenation, because the one that will be deprived are the cells. So again, what is the term that we consider if the cells will be deprived from the oxygen? Hypoxia. If the blood is carrying insufficient oxygenation, that is what we call hypoxemia. From the term itself, hypo, decrease, oxygenation, emia, blood. So eventually, if the person experiences hypoxemia, it will really affect the cellular level and possibly hypoxia. The next thing, why it's crucial, if it may lead to the possibility of hypoxia, the next is tissue death. And once it will cause tissue death, this may affect significantly impulse transmission. Sir, can you elaborate more example? For example, heart is a major muscular organ. So obviously, the major part of the heart, that's why it's capable of contracting, is basically muscle cells. If the muscle cells will be deprived from blood supply, which is hypoxemia, then obviously, will there be a risk of hypoxia to the myocardial cells? Yes or no? Will the
Yes
myocardial
po.
cells? Yes. So the direction of the pathophysiology on the cellular level, if the cells will continuously be deprived from oxygenation, such as hypoxia, then may lead to tissue death. Can you imagine the heart? Can you imagine the heart, that one part of the heart is having tissue death? Will it have equal contraction if one part of the heart is having the tissue death? The answer is no. Depending, or for example, if the right side has the tissue depth, the left side has no tissue depth, there could be no synchronization. And that's the time that it may affect specifically the heart when it comes to its cardiac activity. So that is very important. So if the cell will be deprived from the oxygenation and may lead to tissue death, do the cells of the heart will still continuously have impulse transmission of electrical charges? The answer is no. So that's why if the cells are not anymore capable of transmission of electrical charges, which my set of example I gave you is during the systole, it becomes positive, and during the diastole, it becomes negative. And that is a continuous process. Repeal, eject, repeal, eject, repeal, eject. So the cells may not function anymore. On the right side of the heart, if there is no death of tissues, okay, it will facilitate the normal refill, eject, refill, ejection of blood. But on the left side, if there will be death of tissues, it may cause the delay. So it may not synchronize. Di ba aware tayo dun sa heart sound na lab-dub, lab-dub, lab-dub? If it will cause the auscultation of lab-dub-dub, that is an indication that the heart activity of the right and the left side are not synchronized with each other. So that's why on the cellular level, it will continuously identify on how the cells are very important when it comes to pathophysiology. So how can we check specifically the electrical conduction of the heart, which is facilitated by the cell? So what could be the diagnostic exam? The diagnostic exam could be ECG. Kaya that's why electrocardiogram. So those with the electrocardiogram, it will facilitate if the cells are responding to electrical charges or not. If the cells are not responding, di ba? Pag flatline, anong ibig sabihin ng flatline in ECG? What is your interpretation pag flatline sa ECG? It means that the client already experienced cardiac arrest. There is no cardiac function. The cells are not responding. So there's a possibility that the oxygen of the cell, or rather the myocardial cells, are already deprived from oxygenation. How about what is the indication if too much electrical activity of the cell? It means naman that the cells are too much when it comes to electrical activity, too much active activity that force the heart to have forceful contraction. So that's a different thing. So that's why on the cellular level, it is very important for us to facilitate specifically the knowledge in the pathophysiology that once it will affect really the cells, this may lead to the possibility that it may affect other cells on the adjacent organs or the cells from the particular function itself. Just like kung for example, if it is cardiovascular, it may affect the cells of the heart and may affect the cells of the blood vessels, which is involved in the circulatory system. Any clarifications or questions? I am not seeing in the chat box. Are there any questions so far? None. Okay, so baka masyadong mabilis. Just let me know if I will reverse it to primera from the tercera. Ayan, I have questions. Okay, so bagalan ng konti. Okay, so yun po. Thank you very much. Now, let us proceed with the number 3. With the number 3, we're talking about tissue level. Okay. In tissue level, if the cells, okay, if similar cells are clustered with each other, kanina in the number 1, we have chemical level. Chemical level, molecules and atoms that are composed in a specific cell. On the cellular level, we are talking about the activity of the cells based from the needs that the cells are attaining. Sabi natin, oxygenation, nutrients, and removal of waste products. When these cells are clustered with each other, these will compose tissues. So, for example, if this is a muscle of the bladder, then obviously these are cells that are similar with each other. Meaning, if we will have a tissue biopsy, are you familiar with tissue biopsy? A diagnostic examination by which it may evaluate the tissue characteristics microscopically. On that note, if the tissue, for example, as an example, like the brain, I have mentioned to you, if the brain is identified with endothelial cells, so eventually the cell is composed, or that the tissues of the brain are composed of endothelial cells, when it will be retrieved for biopsy and seen microscopically, that it is somehow the evaluation is out of the characteristics of endothelial cell, and somehow it looks like epithelial cell. Then that's the time that we could have second thought that the client will be subject for additional diagnostic tests for confirmation. But eventually, if there are findings already in the microscopic evaluation that the tissue evaluation are different from what is expected, then clients could be possibly having malignancy. But again, there is a specific diagnostic examination that will be subject for the patient prior to treatment regimen. Kaya later on, as we discuss in the pathophysiology, we will discuss the common diagnostic examinations that will give us the idea the on how this diagnostic examination will determine malignancy, will determine benign cells. Very important yon. Kasi once we retrieve a data which will consider as a sign, that may determine a confirmatory test so that we can conceptualize the pathophysiology. So if, for example, the client had been diagnosed with a certain type of cancer, then what comes to your mind if we say cancer? We can involve cells. Yes. We can involve tissues. Yes, because it has been evaluated. We can involve organ. Yes. So that's why this will give us the idea that the relationship of six structural and functional organization of the body is very important for us to connect how it is related on identification of deviation. Just like in cancer, if, for example, if it is retrieved from the cell, you are retrieve yung tissue from the brain, then we expect what to be evaluated as a normal structure of brain cells and tissues. And it is beyond to the and if it is beyond to the and evident na it's beyond to the characteristics, then that is now a problem for the second evaluation of further tests. So tissue is very important for us kasi this will start specifically if the cell starts its hypoxic condition, as we mentioned in the second level, pwedeng yung cells maka-affect sa tissue level on a wider perspective. Example, let's go back to the function of the heart. Di ba? If the cells are deprived from oxygen, it will lead to hypoxia. After the hypoxia, pag nag-tissue death. Pag nag-tissue death yan, one portion of the heart lang is affected. Will it be possible na mag-extend yung mga tissue death to other parts of the heart? Will that be possible? Now, if it will extend from one part to the other parts of the heart, now the affected level is already tissue level. Okay? So next po. So please, you may raise your hand if you have clarifications. And if you have questions, address it to the chat box. So I will now proceed to the next. The next is all about the organ level. Okay. If we have started on the chemical level, on the molecules and atoms, then on the cellular level is on how the cell will function according to the needs of oxygenation, nutrients, and waste products. On the tissue level, these cells are clustered into one, while the organ level, ayan na, the organ level is composed of two or more tissues already. Because example, a typical example is the bladder. Bladder tissues are layered. Okay, layered yan. The bladder tissues could compose of connective tissue, smooth muscle tissues. Okay, so there are two tissues that are identified in the bladder. Sir, why is it that the bladder has also muscle tissue? Because the bladder contracts and relax. So that is muscle tissue. And what is the why is it, sir, that it has connective tissue? The connective tissue is very important so that for the protection of the outer covering of the urinary bladder. So if the connective tissue is the outer layer, that tissue protects the smooth muscle tissue. And thus, this will comprise one organ, the urinary bladder. So the urinary bladder had been identified with one function. Okay? So let's have another example. Another example is uh, blood vessels. Blood vessels may have uh, two tissues also that is present. We have also connective tissues, and we have also the blood vessels has also the adventitious tissues. So with these connective tissues and adventitious tissues, it's capable of ejection of blood because these two tissues compose the blood vessels to facilitate circulation. So two tissues are present and composed of one organ itself, then that is what we call organ level. Next po, we have the organ system. The organ system could be identified specifically that it is composed of one or more organs, but it has a common what? Common function. So, for example, I just want to have a review before we proceed with the to have questions related to self-assessment and other than before we proceed with the review of systems later on. What could be the system that is responsible for the production of hormones necessary for compensation of the dysfunctions of body? What is the system or group of organs that compose an organ system that is responsible for the secretion of hormones and intended to facilitate a specific function? Any from the group may answer. Yes, Mr. Buen Consejo.
Endocrine system po din.
Very good. That is correct. Because one of the distinct functions specifically and identified function of the endocrine system is the regulation of hormones. Thank you very much, Sir Harold. Next, how about when it comes to the another is when it comes to the production of enzymes necessary for breakdown of food. Yes, Miss Jaila?
Digestive system po.
Very good, digestive system. Why it leaded you to that particular answer? It's because the function itself is related to breakdown of food. Now, when it comes to the breakdown of food, we may not just only associate with the organ stomach, because di ba we have also the upper gastrointestinal tract and we have the lower gastrointestinal tract. Ano bang ating upper gastrointestinal tract? Ang upper gastrointestinal tract natin ay composed from the time that the food enters the mouth until it passes through the esophagus, until it enters the stomach, until it has been absorbed by the intestine. So these are organs responsible for the digestive system in the breakdown of food. Thank you very much. That is definitely correct. Now, what is the system that is composed of organs responsible for the impulse transmission so that to facilitate compensation to the dysfunction of the body? What is the organ?
Nervous system.
Okay, so the answer, Miss Abante, is nervous system. So that is correct. What made you from that definition direct you to the nervous system is because of the impulse transmission. Because we all know that in the impulse transmission, we have the axon and the dendrites, which is responsible for the impulse transmission and electrical charges on how the body will respond to this function. So those, when it comes to the nervous system, di ba, we have the brain, the spinal cord. So the brain and the spinal cord are the ones that is very significant when it comes to impulse transmission, because we all know the brain controls the various organs of the body when it comes to functioning, and specifically also with the spinal cord. So next, we have the organism level. When we talk about organism level, this is somehow the whole, the person, the human being. Each and every one of us definitely have the 11 organ system. No human being had been identified of missing organ system, because eventually the body will be on the state of health if your 11 organ systems are intact. Now, sir, will I not be anymore be considered as organism level if I miss one kidney? No, because the other kidney can still facilitate to process the regulation of fluid balance and other regulation when it comes to RBC and regulation of blood pressure. Sir, will I still be part of the organism level if I have there's amputation of the one leg? Yes, because you are still organism level, because one of the leg are still present, and you can still be it can still facilitate the normal functioning of the body, because it can circulate to the other leg, and which is necessary for that functioning leg. So that is what we call organism level. Now, let us now connect on a perspective on how it started, on how we will apply the six structural and functional organization. Example, di ba? We have the number one, we have the chemical level. We have the atoms combined to form molecules. And these molecules could be protein filaments, yan, yung mga very important for tissue, okay, tissue and cellular function na nagpapacilitate ng action of the molecules and cell. These molecules and atoms on the chemical level, kaya nga pag sinabi natin chemical, cellular, chemical reactions, it is always related to the function of the molecules and the atoms, which will affect the activity of the cell. So, which, for example, we're talking about smooth muscle cell. Smooth muscle cells are made up of molecules. Always remember that. It always starts with that number one. So that is the second level, which is the cellular level. The next is the tissue level. In the tissue level, from the cells itself, once it will be clustered together, it will compose of tissue. So the smooth muscle cell, once it clustered together, it becomes smooth muscle tissue. Okay, so that's on the third level. So we have the tissue level. Now, these tissues will be combined with the different types of tissue, which I mentioned. We have epithelial tissue, smooth muscle tissue, connective tissue. This is definitely what we call the blood vessel. The blood vessel is the internal tissue that we have is epithelial. The mid part of the blood vessel is smooth muscle. The connective tissue is the outer layer. Always take into consideration, connective tissues are always on the outer part, simply to protect that specific organ. If the if the organ specifically are having functions when it comes to contraction, always take into consideration that it has muscle tissues. Heart has muscle tissues. Heart has also connective tissue. In the heart, what is the connective tissue? The outer covering. The part that it has the muscle tissue is on the mid, which is the myocardial. And the one that is protected with the epithelial tissues are the ones that are connected within the different bulbs of the heart. Now, when it comes to this, so what we have mentioned, di ba, the organ is made up of different tissues. So ito ay blood vessel, epithelial, smooth muscle, and connective tissues. That's why whenever a person is experiencing smoking, the nicotine, the part of the blood vessels that could be damaged is the epithelial tissue. Alcohol. When it comes to the increased alcohol intake, it will cause irritation of the epithelial tissues. It may cause constriction. So, in this way, we are talking about three tissues that compose the blood vessel as an organ. How about for the organ system? Since we talk about the organ system, this is composed of the circulatory system. So, as part of the circulatory system, it involves the heart because the blood enters the heart for the conversion of oxygenated and non-oxygenated blood. And this organ system will be joining the circulatory system with the other 10 systems of the body to make the person becomes organism level. So that's why class, kung for example, nag-start ang problem natin with the cells itself, it will continue po the problem all over this system and may affect the person when it comes to his or her function. Sir, will there be a possibility, for example, the damage are done in the epithelial tissue? If the damage are done in the epithelial tissue, it will affect the tissue level, or probably it may affect the other tissues that is composed of the organ, such as the blood vessel. Kung na-damage sa epithelial tissues, pwedeng mag-cause ng damage with smooth muscle, with connective tissues. If these are damaged already, the tissues are already damaged, the cells are already deprived from those oxygenation, it will affect syempre yung molecules and atoms because it will not respond. The problem is if the molecules and atoms of the cells will not respond, then that is now may lead to the affectation of the blood vessel. Now, pwede bang maka-affect yon sa organ system? Yes, because it may affect specifically the heart when it comes to cardiac output and may create a problem to the person as a whole by herself or himself. Now, let's have a typical example of the flow. Okay, this is a typical example of the six structural and functional organization of the body. Example, can you give me an example of the risk factor that may lead to a possible effect to the heart? Any risk factors that may lead to a cardiovascular disorder or problem? Anyone? Yes, Miss Abante?
Elevated blood pressure po.
Okay, so kung elevated blood pressure po yan, from the term itself, elevation of the blood pressure, there's increased intra-arterial pressure. Kung increase ang intra-arterial pressure, then what could be the next problem? Kung increase ang intra-arterial pressure, pwede po bang maka-affect yan sa molecules and atoms of the cell? Pwede po ba yan maka-affect? If there is a pressure, intra-arterial pressure caused by the hypertension, pwede po bang maka-affect yan sa function ng atoms and molecules of the cell? The answer is yes or no?
Yes po.
Yes, okay, yes. Kasi the pressure itself may cause the possibility that the cells becomes more either active or passive when it comes to response. It may not compensate, it may compensate. That's the problem. If it may compensate, it will still sustain the function of the heart. If it may not sustain anymore, that may lead to the continuous problem. Okay, now, if the cells are not responding anymore, the protein filaments that is composed on the chemical level is very important. Why? Kasi if the atoms and molecules are deprived from this problem of hypertension, then supposedly the blood vessels will respond to compensate. Pero kung halimbawa, if the person has already existing problem with the blood vessel, obviously on the chemical level, there will be already a problem that may affect the what we call cellular level. Kung ang mga atoms and molecules cannot anymore transmit impulse for the cells to become active and compensate to the problem with hypertension, the cells will not be anymore active to transmit impulse and correct blood pressure. So what comes next? So if in the cellular level, the cells are not active anymore, it may affect the muscle tissues. How the muscle tissues will be affected? Since on the cellular level, the cells are not capable of transmitting impulses for the muscles to continuously contract, the number 3 will affect tissue level. The muscle cells the muscle cells or tissues rather will not facilitate what is indicated to, which is supposedly contraction. Now, when it comes to this contraction, if it will affect one portion or the muscles of the level, obviously, cardiac muscle tissue, the number 4, which is the organ level, will be affected, obviously, with the heart. Now, when it comes to the organ system, since the heart is part of the circulatory system itself, since the heart will not anymore contract, may decrease cardiac output, do you think it may affect now the number 6 or the organism level? Yes or no? Yes. To what extent? It may cause the possibility that the hypertension may lead to the possibility of decreased cardiac output, and it may affect the other systems of the body because of that situation that started with hypertension. Now we see on how the flow started from the atom because of hypertension, and pagdating sa organism level on how it will cause secondary complications. Dun, in those flow of the pathophysiology, we can already identify how it will affect other parts of the body or how it will definitely affect the circulatory system itself. And since this is related to circulation, obviously, this may cause problem with possibility sa brain. It will cause a problem with other organs of the body. Let us now proceed to the self-assessment exercise. Everyone are open to respond with our self-assessment exercise by raising your hand on your so that I will recognize students who will participate. So let's start. Number 1 question. The nurse performs assessment to a client in the medical ward. She processed findings that covered the 11 organ system. It means that she covered from the 6 functional and organizational level: A, chemical level; B, tissue level; letter C, organ system; and letter D, organism level. So I will call the first one who raised her hand, Miss Abante.
Letter C po din.
Letter C. So again, let us try to consider if it is the letter C. The answer is organism level. Diba, as what I have mentioned po, if the organ system itself is composed of similar organs that have been identified with the system. But if we're talking about the 11 organ system, that is that the human person or the person that compose the organism level. So nice try, almost close to the correct answer, but probably you can also still participate with the next question. So answer, chemical level are more on the atoms and molecules. So we have the tissue levels when the cells are combined. The organ system are composed of 2 or more tissues. Next question. The nurse checks the client's health status, after administration of drugs intended for kidneys. Which of the physiological events are correct? Will it start with kidney cells, molecular activity, kidney tissues, then kidneys? Letter B, molecular activity, kidney cells, kidney tissues, and reach the kidneys. Letter C, kidneys, kidney tissues, cells, then molecular activity, or letter D, it starts with kidney tissues, cellular activity, then proceed with kidneys. So the first one who raised her hand is Miss Micaela Alimbuyugi.
Din letter B po, yung start po siya sa molecular activity, kidney cells, kidney tissues, and sa organ po, which is the kidney po.
Okay. So eventually, what could be the basis if that will be the answer? That is the correct answer. What is our basis? The basis is the 6 structural and functional organization. The atoms and molecules on the chemical level. Then we have the cellular level, we have the tissue level, and we have the organ level. If the kidneys will proceed to the affecting the other organs involving the system, then that may have the organ system. Okay, so your answer is correct. Next question. Oh, why there's a missing ano? The nurse attends to a client with difficulty of urination. The client was subject to diagnostic examination of kidney, ureter, bladder, ultrasound. The organization refers to, is it organ system? Is it tissue level? Is it cellular level? Or is it chemical level? The first to raise the hand is Miss Lindsay May Bradesina. Answer?
Organ system po, A.
Okay, let's see if that's the answer. The answer is organ system. What made you decide to have the organ system? The kidney, the ureter, the bladder are composed of the urinary system. Okay. Next question. The nurse refers the client for treatment regimen to a specialist and will consider study of the effect of disease on cell, tissue, organ, and system. Okay. It refers to a special physiology, a systemic physiology, a pathological physiology, or cell physiology. The first to raise the hand is Miss Ashley Brent. Arbo.
Letter C po, pathological physiology po.
So let's see if the answer is correct. The answer is correct. Pathological physiology. Because if we consider special physiology, this pertains to what? Organ. Systemic physiology, this refers to the system as a whole. Cell physiology is the study of the functions and processes of the cell. Pathological physiology is how we will connect the disease process on its effect to the cell, to the tissue, to the organ, and system. That's why we have the orientation of the 6 functional and structural organization simply on how it will affect from the time of the chemical up to affecting the organism himself or herself. Next question. The nurse assists the client with head injury. Which of the following diagnostic examination can only diagnose damage to skull? So probably you may have an answer here, which I have not mentioned, but this question will facilitate analytical and critical thinking. Can we have computed tomography or CT scan? Can we have ultrasound? Can we have magnetic resonance imaging? Or can we have X-ray or radiographic test? The nurse assists the client with head injury. Which of the following diagnostic examination can only diagnose damage to the skull? So, the first one who raised her hand is Miss Ana Karaig.
Good evening po. Letter D
Yes.
po.
Letter D. So, let's see if the
X-ray
answer
radio.
is correct. The answer is correct. Thank you very much. Why is it X-ray or radiographic test? Simply because if we have the computed tomography or CT scan, this may facilitate the examination of the head affecting the blood vessels. Okay? If we are considering, not the blood vessels, I'm sorry, I stand corrected. Computed tomography will identify any damage on the tissues or if there is bleeding. It may identify pressure on spaces within the brain and the skull. Now, for the ultrasound, usually the ultrasound is a diagnostic examination that can facilitate the movement of the brain itself, its actual movement, just the same as for the actual, what do you call this, the sound that has been created on how the brain functions. Letter C. Usually ultrasound are not indicated for the brain kasi nga it may not be useful in a way, but there are other diagnostic examinations such as CT scan, MRI, and X-ray. However, we may not have magnetic resonance imaging because in magnetic resonance imaging, the difference with computed tomography is it may identify the damage within the tissues, but for magnetic resonance, it will give us more detailed results on the tissues and blood vessels. And this may identify if it is artery or vein. On the radiographic test or X-ray, it may only identify the structure, which is the skull, if there is a problem with fracture. Okay? So, now, let's have a review of the different systems of the body. For the different systems of the body, we have identified that in the integumentary system, the major organs are the following: the skin, the hair, the sweat glands, and the nails. That's why, for example, let's have a typical example that may affect integumentary system. Skin rashes brought about by sunburn. Ayan, pag sunburn. Okay, if we're talking about sunburn, then obviously the major organs of the integumentary system that are affected are, can you identify? From the 4 major organs, the skin, the hair, the sweat
Skin
glands,
po.
nails,
Skin po.
skin. Any other major organs that are affected for sunburn? Will it affect the hair and the sweat glands?
Yes, sir.
It may be affected, correct? But once if we will try to prioritize what is the initial organs from the integumentary system that is merely affected by sunburn, we could answer skin. And later on, it may affect the hair and the sweat glands. Kasi the skin is composed of the hair, and the hair is very significant when it comes to the removal of the what? Removal of the waste products from the skin, right? It's very important. The sweat glands are very important because the sweat itself, that is produced by the glands are very necessary to protect from infection and removal of waste products. So from this perspective, if the skin reach to the point of damage, then this may affect specifically the other parts of the organ. It may affect the production of the sweat, which may facilitate, kasi pag ang sweat glands po ay na-damage, there could be a possibility yung supposedly na-release na sweat ng body will be retained to the hair follicle, which is eventually present in the hair. So is there a possibility ba yung supposedly na nailabas or na-release ng body natin from the sweat and will retain to the hair? Pwede bang mag-cause yun ng infection? Will that cause an infection? The answer is yes. Kaya in that matter, if there is a sunburn, the skin may significantly affect the hair and the sweat glands. And usually pag sunburn yan, di ba, pwedeng mag-cause yan ng meron tayong tinatawag kasing dermatomes. The dermatomes are the ones present through the skin. Very sensitive ang skin, di ba? Kaya tawag natin diyan yung senses din that will involve. So that's why when the skin are affected, usually painful yan. The lower the superficial part of the skin is affected, the higher chances of pain motor response. So the hair could be affected and the sweat glands could be affected if the degree of sunburn affects the layers of the hair and the sweat glands. So that's why when we talk about the problem with the pathophysiology, we will take into consideration na, okay, when it comes to sunburn, we will consider only the skin. You must take into consideration also that in the pathophysiology, the importance of the presence of the skin, the sweat glands, and even the nails are significant because they are connected with each other because it composes the integumentary system. Because the function itself, ito na po yung processes, yung function that is very important for physiology. Yung sunburn had been considered as the deviation. So yun yung problem natin with pathological, with the disease. How the disease itself may affect the organs. So we have mentioned the skin, the hair, the sweat glands. So when it comes to the functions, this will guide us. Ayan, this will guide us na if the skin are affected due to the sunburn, so pathophysiology na tayo. Yung patho, yung sunburn, yung physiology may affect the skin, the hair, and the sweat glands. So focus na tayo into the functions wherein there is a possibility that the person may have a sunburn, patho. The physiology that may be affected is protection from the environmental hazards. Kasi if there is a sunburn, it may not sense further damage of the skin. Will it affect the regulation of body temperature? Yes, because there could be a possibility that the sweat glands also is responsible for the regulation of body temperature. Next, sensory information. You could be high risk for injury because that sunburn that may affect the skin may not determine specifically the senses on the information that may cause a possible hazard or damage to that part. So in this situation of knowing the integumentary system, it will give us the idea that once there is any problem affecting the integumentary system, we can associate that these major functions must be the one that I will expect to the diagrammatic or pathophysiology. Kaya pag nag-pathophysiology kayo, always refer to the function. If it is affecting the skin, then next is there a possibility that it may affect the hair and the sweat glands? Then proceed na kayo sa functions na these are the possible deviations of affecting integumentary system pag may sunburn. Yon, that's why it is very important dito po, class, on how to have the mastery already of the anatomy and physiology as our foundation. Next, nervous system. When it comes to the nervous system, the major organs are the following: the brain, the spinal cord, the peripheral nerves, and the sense organs. Okay, let's have a problem with spinal cord injury. Okay. Spinal cord injury, for example, is now the pathologic disease. So pathology, that's the disease. Okay, the injury itself. Okay, spinal cord injury. So there is injury of the spinal cord. So from the major organs, will your question to yourself, you will question yourself, will it affect the function of the brain? Will it affect the peripheral nerves? Will it affect the sense organs? To what extent that it will be affected? So for example, we are aware that the spinal cord is the one that regulates responses of the body. So ibig sabihin, it means that if the spinal cord will have an injury, it may not transmit impulse that is related to the brain function. Of when is the brain will transmit impulse to the major organs. So that's why if you will notice, di ba, ang usually pag merong spinal cord injury, ano ang nagmamanifest sa patient? Usually ang nagmamanifest sa patient pag may spinal cord injury is either a problem with mobility. That's why I know for a fact for some of the mga avid fans of basketball, 'di ba usually pagka if there is an injury and affecting the back, usually the person will be immobile and will check for the possibility of the spinal cord injury. It will check specifically if the hands, if the person can move the hands, if the person can move the lower extremities, if there is a problem with the mobility of the hands and the mobility of the legs, then that is a possibility of suspecting spinal cord injury. Because class, paralysis usually is associated with the spinal cord response, and this will affect mobility. So doon na tayo tumitingin on the perspective of how you will connect it with the pathophysiology. The pathology, class, di ba ang spinal cord, ano pa yan? It is divided into cervical, thoracic, lumbar, sacral. So, di ba ang spinal cord din natin, pag if we say thoracic, kino-cover niya yung function ng mga major organs sa thoracic cavity, the lungs, the heart. So very crucial, ayan ha, very crucial if for example, the spinal cord injury is in the thoracic. So you will check as a nurse, check function of the heart, function of the lungs. So yun ang nasa major system affecting the thoracic area. So if the patient has the problem with the thoracic on the T1, the T2, on the spinal cord, then the possibility ba that the client, if there is a severe spinal cord injury on the thoracic area, may lead to possible bang cardiac arrest? At pwede bang mag-cause yan ng respiratory arrest? The answer is yes. That is now the basic knowledge that you must consider. You will connect the function of the spinal cord specifically on that part of the spinal cord and connect it with other organs. So we have connected it. If the T1 or rather the thoracic spinal nerves are basically on the function of this of the area, specifically the function of the respiratory and the cardiovascular, then that's the one that we need to evaluate. So another, for example, if the affected area is lumbar. Kung lumbar naman siya, anong part specifically yung affected niya? Di ba nasa baba na siya? Lower part of the body. Kung lumbar na siya, nandun na siya sa part ng intestine, nandun na siya sa part ng urinary. So what you will observe naman? Ang i-observe niyo naman po, if the person has a problem with the spinal cord, specifically sa spinal nerves, then you will check urination, you will check response of the intestine for the passage of stool. Yan. So Kaya that's why usually po, class, pag nag-spinal cord injury affecting the lumbar and usually sacral, lumbar muna, lumbar, usually urination is uncontrolled na. So hindi na makontrol. Naku, there's an indication that the spinal nerves are specifically the lumbar nerves are affected. So it gives us the idea in the pathophysiology, the pathological problem is spinal cord injury. How can we answer it in the physiology? Yung process itself of what is the function of the spinal cord. It has the spinal nerves. It transmits impulse. Then how you will connect it with the six structural and functional activity. It will affect the intestinal contraction. It will affect the urinary bladder. So urination and passage of stool. Passage of stool will be affected. So dun tayo ngayon we will focus na. So now, since meron tayong the patient may have the spinal cord injury, then we will focus na ano yung function. We will check to direct immediate responses to stimuli. That's why, di ba, even sa newborn, I know, siguro alam niyo to di ba sa upward scoring reflexes are very important. So that's why if in the absence of reflexes, nervous system ang affected. Kasi the reflexes itself, the nerve, the motor stimuli motor response. So yung coordination din po, as at yung example ko, yung coordination and moderate activities of the other organ system. Kaya that's why I connected yung sa thoracic in connection with the function of the heart and the lungs, sa lumbar in the function of the intestinal and the lower extremities. So that is connected. Usually it gives us the idea on the perspective na, for example, identified siya, hindi na move yung upper extremities. Nako, upper extremities. So there could be a possibility, i-check ko yan, cervical or thoracic. Tapos the next thing to check is, are you breathing? Are you experiencing difficulty of breathing? Do you experience heart palpitations? So the nurse is already alert when it comes to the pathophysiological perspective. Okay? Next po. The next po is the skeletal system, which is the foundation of the body. Now, usually, ang orientation natin dito, bones. Okay. So, kung for example, nagkaroon ulit ng physical injury sa basketball. So, the next is, first, you will check spinal cord injury, the nervous system. So, the next is, if the person cannot move the specific part. Example, usually, pag spinal cord injury, both of the extremities niya ay hindi niya ma-move. But if there is a possibility that one of the extremities lang niya ang namumove sa right, pero yung left niya hindi niya namumove, then specifically we'll check the skeletal system. Pero usually pag may mga spinal cord injury at saka mga injuries yan, they must be immobile kasi baka mamaya, alam nyo, the point of why they need to be immobile, di ba nilalagyan sila ng neck collar. They are instructed to be on the stretch on a stretcher and place them on a position that will not cause mobility. Kasi ang isa naman, one thing that are being evaluated there is chances naman na pwedeng may problem with fracture. Do you think if the person will still move that part na may fracture, pwede bang mag-extend yung fracture niya dun sa other parts of the bone? The answer is yes. That's why we need to associate that point na if there will be a suspecting fracture, then it must be immobilized. So what is the problem, sir? Kung may fracture. So i-connect natin ngayon yan. Kasi ang problem nito po is if the bones are having fracture, we are aware that this will provide support. So the person may have may affect mobility. Okay? Other than that, alam po natin na specifically, ang person who may have fracture, itetest po yung level niya ng calcium. Okay. So, ikaw as a nurse, i-connect mo ngayon. Okay, suspecting for a problem with the fracture of the bone. The next thing you will do is expect the patient will have what diagnostic examination? If you're suspecting for fracture, what diagnostic examination kaya yung probably next na sa subject for patient? Fracture.
X-ray po.
X-ray po.
Correct, X-ray. So anything that is related to the bone and the skeletal structures, it's always X-ray. Ngayon, if there is a confirmed damage of the bone, and obviously it leads to a problem with the fracture, what comes next? You need to check calcium. Why do we need to consider calcium? Any response? Why do we need to check the level of the calcium, serum calcium? What is the purpose of calcium when it comes to bone?
Kasi po, it strengthen the bones po.
Correct. Because the bone it stores the calcium, and this calcium is very important to prevent the fragility of the bone. Lalo na, or for example, if the client has been confirmed with fracture, then there is a decrease in the level of calcium. Is there a possibility na matagal mag-heal yung bone? The answer is yes. Will there be a possibility that the fracture may extend? The answer is yes. So that's why another concern po natin is one of the function din ng bone is blood formation, di ba? So bone is a structure that is responsible for the production of red blood cell. So the next thing you will do is, since connected siya sa production ng red blood cell, so you will check the level of the RBC. So doon na tayo, in those functions that you will be oriented on the skeletal system, you will connect what could be the confirmatory diagnostic examinations that I may consider. Remember class, there are some hospitals here in the Philippines that it will need more independence in your decision. It may not need anymore the order of the doctor. You can facilitate the subject, you can facilitate the client and subject the client for diagnostic examination as long as you have the competencies and can depend and even evidently justify that the person may need to check serum calcium, the person may need to check the erythrocyte level, then you will respond. Since we are suspecting for fracture, and this supports the function of the formation of the red blood cell and the storage of calcium, so eventually this is very important for tissue healing. So yun. So that will bring confidence to you. Okay. So we are now 6:54. So I'm not violating again another rule. Supposedly 6:30. We must have the break. But anyway, we'll finish at 7 for us to have the 15-minute break. Endocrine. Okay, for the endocrine po, we have been oriented on the different glands. Any glands in the body may correspond with the specific hormones. Pituitary gland. The pituitary gland is sa brain. We have the anterior and the posterior pituitary gland. It facilitates the major response sa body. Remember class, hormones are very important for metabolic activity of the cells. Once the endocrine system is damaged, once the endocrine system is the one that are injured when it comes to its organs, ayan na. This may cause affecting major organs of the body. Katulad ng adrenal glands. Kung adrenal glands, we are aware, it's kidneys. So gonads, this is basically for the female. Testes and the ovaries are the ones that are responsible for the production of the hormones. So usually, di ba, are you aware of the mumps or beke? That's why the situation goes na why sir pag nagkakabeke there is a possibility that it may affect the fertility ng male, because this is somehow responsible for the immune system that may affect significantly hormone production. So yun, so this may significantly affect on the reproductive status of the male. So endocrine tissue. So that's why you need to still consider one thing that makes endocrine system is very important, metabolic activity. Tandaan nyo yan. And metabolic activity is very important for the cells. Okay? Next po, muscular system. With the skeletal system as a support and protection. The muscle system is the one that makes the body and different organs facilitate movement. So, muscular is associated with movement. So that's why if the person may have the problem with the physical injury affecting the bone or fracture, so the client will be subjected for immobility kasi pwedeng mag-cause din yan na ang muscles are inflamed. Di ba usually pagka injury, pwedeng nag-cause ng direct trauma sa muscle. So kung inflamed siya, there is a possibility that it may cause the tearing of the muscles at pwede yan mag-cause sa inflammatory process. Magkukos pa siya ng another complications. So that's why it's very important po, class, that ma-associate natin yung fracture as a skeletal and associate also the muscle in relation to the problem with fracture because the possibility that they are connected with each other. That is what we call pathophysiology. We will connect if tissues are affected, we will connect to the skeletal tissues that could be affected also. If the cells of the skeletal system is affected and the cells of the muscles are affected, we will connect how it may cause the possibility of complications. So this refers to the movement. Okay. Now, so obviously, then the cardiovascular or the circulatory system, we have the heart, the blood, and the blood vessels. These three major organs, if it affects blood vessels, it will always facilitate affectation of the blood and the heart because the blood itself is the one that distributes. How it will be distributed? Through the blood vessel. How it will be ejected and converted to unoxygenated to oxygenated blood? It's with the heart. So that's why every time that I give example that is related to heart, I always connect it with the blood. I always connect it with the blood vessels. Next, lymphatic system. Lymphatic system is responsible for the immune system. That's why every time, kaya sometimes the nodes are distributed all over the body, same as the blood vessels. That's why these are the major organs: the spleen, lymphatic vessels, lymphatic nodes, lymph nodes, and tonsils. That's why it's very important to take into consideration, class, pag kayo ay nag-tonsillitis, what is the organ that could be affected? What is the organ that could be affected pag may tonsillitis?
Tonsils po.
Yes, the tonsils. So kung nag-cause ng inflammation ng tonsils, what other organ could be affected pag nag-continue yung infection? Anyone? As a complication. Okay, let's connect. Class, don't ignore tonsillitis because this may ayan. Miss Puentebella, probably you can answer.
Sir, yung
Yes, Miss Puentebella.
sir,
Yes.
yung heart po ni patient.
Yun, very good. Correct. Kaya that's why you will not ignore tonsillitis simply because this may cause the possibility of infection to the heart, specifically endocardium. This may cause endocarditis. Ang endocardium, di ba nandun yung mga valves of the heart? Ayan. So other than with the valves of the heart, nandun si atria, nandun yung ventricles. These are the areas that could lead to the possibility of inflammation and infection pag may tonsillitis. Kaya do not ignore. So this is somehow related to the infection, immune system, but may cause a possibility of complications. So we have the urinary system. So as what I have mentioned, these are composed of the kidneys, the ureter, the urinary bladder, and the urethra. And usually, urinary system is associated with what? Excretory. Okay, excretory is related to fluid balance. This is related to the concentration of the ion and the pH. Usually, class, if you will encounter bicarbonate, the regulation of the bicarbonate is with the kidneys, and that is very important when it comes to the acid-base status of the client. So we are just having the review. That's why I'm not leading any more to details. The respiratory system, so we are very particular with this in our situation now. So that's why if you will notice, if the SARS-CoV-2 will enter the body, it enters nasal cavity, sinuses, larynx, trachea, bronchi, lungs, until alveoli. Once the alveoli as a basic unit will be affected, class, the alveoli is the one that is connected to the pulmonary system. Pulmonary system and the heart. Okay, the heart. Kaya that's why that occurs, yung alveoli kasi, it's connected with the heart simply because this occurs yung tinatawag nating gas exchange, yung conversion of unoxygenated to oxygenated blood. Kaya usually pagka may mga situations of the problem with the infection, specifically viral infection, dapat ma-prevent na agad yan. Plus, once the coughing reflex are stimulated, yung coughing reflex it's stimulated by what major organs of the respiratory system? Saan dyan ang coughing reflex na na-stimulate? Is it with the sinuses, the larynx, the trachea, the bronchi? Answer. Toot, 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 toot. The answer is larynx. Okay? Yung coughing reflex. So once mag-cause na yan ng irritation of the larynx, the coughing reflex. Plus, don't ever consider yung coughing reflex po ninyo or coughing itself is bad, bad sign. That's an indication of the response of the body pag merong cause ng irritation at obstruction. Although, it is seemingly considered in the COVID-19 before, simply because that's an indication na that it affects the upper respiratory tract. And remember, the SARS-CoV-2 facilitates the production niyan, or rather the increase in number dun sa upper respiratory tract. So I may not elaborate this anymore, but I connected it with how the respiratory system is affected. Now, the digestive system are connected with each other because this is related to the breakdown of food. From the teeth up to the from the teeth up to the pancreas, stomach, this is responsible for the breakdown of foods. Enzymes, yan, enzymes, breakdown of food, removal of itong food that had been breakdown and will be excreted by the body. This is definitely digestive system and related to breakdown of products. If you can still remember yung discussion nyo sa nutrition at saka sa anatomy and physiology, di ba usually pagka ang carbohydrates na breakdown yan into smaller substances, it is the end product is what? What is the end product of glucose? Glucose, I'm sorry. Carbohydrates. Binanggit ko na yung sagot. So the end product of the oh my God. The end product of the carbohydrates is sucrose, fructose, glucose. What is the end product of the protein? What is the end product of protein? Which is necessary for the repair of tissues.
Amino acid po.
Very good. Amino acid. So that's why decreased level, if you will have injury of tissues, usually the one that had been advised to facilitate tissue healing is high protein diet because this will facilitate tissue healing. Next, how about for fats? What is the end product?
Fatty acids po.
Very good, fatty acids. Di ba ang carbohydrates ay yan ay pinagkukunan natin once the glucose is the carbohydrates is converted as end product of glucose, pinagkukunan natin yan ng calories energy. Okay, the calories are not sufficient, ang fatty acids ang nagpo-provide ng regulation of the calories as an alternative. So which is very important. So i-connect nyo yan. I-connect nyo yan. Pag too much carbohydrates, is there a problem pag too much carbohydrates ang intake? So chances na pwedeng tumaas ang glucose level of the blood. Okay? If there is a chance of high protein naman, pag too much protein naman, this may also be harmful. Kasi usually, the protein naman may affect specifically the function of the kidneys. Pagka too much naman ng fats and converted into fatty acids, so too much of itself may affect blood vessels and may affect the liver as well. So yun, we connected those concerns anymore. So we have the male reproductive system, which is somehow, di ba, eto in the increasing age, what part of the male reproductive system ang pwedeng nagko-cause ng enlargement? Pag nag-andropause, pag increasing age, ito yung nagkakos ng thickening of the tissues that made the person on the andropause stage kasi bumababa na yung hormone. At pag bumaba na yung hormone, nagdi-decrease na rin yung erection, di ba? Any answer?
Prostate gland po.
Very good. Prostate gland. That's why in the increasing age, for male, high risk po for prostatitis. Yung inflammation o prostatitis, yung inflammation of the prostate gland. Kung di man siya inflammation, thickening itself, kaya usually prostate cancer is high risk also. So next po for the female, so we have the ovaries, uterus, vagina, the labia, the clitoris, and the mammary glands. So these are usually, it facilitates usually the changes sa inyo by hormones during the time of puberty. Kaya pag kinonect mo yun sa pathophysiology, normal yung puberty on this development of the hormones. Pero may mga instances na why is it there are chances na by physical features it is expected that there will be supposedly changes in the size of the breast pero hindi nagko-cause ng enlargement of the breast. So there could be two problems with that. The problem is either number one, there could be hormones, or the number two problem is possibly the tissue mass that may cause the possibility of the size of the breast. So doon tayo doon tayo magko-connect. Okay? So I think you deserve a break. Okay, you deserve a break before we continue. So let's have first the 15-minute break before we continue naman with the 6 characteristics of life. So hydrate yourselves. Maximize the 15 minutes if you need anything. Thank you. Okay, class, let us continue for the next 10 minutes of the continuation of our synchronous. Since we have already ended up with the discussion of the uh, six structural and functional organizations, and at the same time as a review of the systems, it's very important for us to connect this with the 6 characteristics of life: organization, metabolism, responsiveness, growth, development, and differentiation, and reproduction. Actually, when we talk about organization, this is on how the specific relationship of the many individual parts of the organism. That's why when we identify the 6 structural and organizational level, we have identified the relationship accordingly of each cell. So that's why each structure and cells of the body are defined with peculiar characteristics. So as what you have noticed in the projected on slides, this will give us the idea that these cells are identified accordingly so that to facilitate a problem with microscopic evaluation if it is not distinct with that particular type of cell. So on that note, when we talk about the relationship, this is somehow also related on the development of the zygote, the embryo, before it becomes a full-blown fetus and newborn as well. The development of the embryo to a newborn significantly have the development through these cells also. So that's why it's very important for us to why we need to study the different cells itself, because it will give us the idea of when is the time that the cells are deviated, and at the cellular level it will affect the tissues, the organ system, until the organism itself. When it comes to the metabolism, it is the ability to use energy to perform vital functions. We have mentioned that the cells will definitely need the metabolic process. We have identified hormones. We have identified the source of the nutrients of the cells, such as from the food. That's why usually the body regulation or the body heat is regulated accordingly through the sources. And class, if we will have increased metabolic activity, the more that it will produce heat of the body. The less metabolic activity that we may have, the less regulation of the body temperature. So what could be but the question is, sir, why is it that even we are not eating anything, we are not experiencing a problem with the hypometabolism? Actually, in reality, if you're not eating any food at all and you skip meals, there will be metabolic activity of the cells. That's why you may experience possibility of lightheadedness when you are not eating, because the cells are deprived from oxygen, and it may not transmit impulse to your brain to maintain your alertness. So that's why from lightheadedness, and if you deprive yourself from food, you may experience faintness, and you may possibly lead to unconsciousness. On that note, it is very important that the metabolism and the source itself which is very important and essential for the survival of the cells. So that may connect not just only with the digestive system, that may connect also with the cellular activity. Responsiveness. Sa responsiveness, we are using the principles of the convection, radiation, evaporation, and conduction. This is on how we use the senses. And this is very important for us to know specifically yung rationalization of why these principles are very important. If, for example, for a person who may have fever, the chances, which of this principle may possibly consider po that the person who are febrile may lead to dehydration? Is it convection? Is it conduction? Is it radiation or evaporation? Which of the following principles could consider a person who is febrile to be high risk for dehydration? Any answer? What principle? Yes, Mr. Harold.
Evaporation po din.
Correct. Evaporation. Because simply, di ba, the too much heat itself may have the insensible losses. The sensible losses that we may have is via urine. in the form of urine. But too much heat of the body could have also evaporation of the insensible losses. Even in difficulty of breathing. In difficulty of breathing, you may experience also dehydration, but you may not see it. That are considered as insensible losses. So through this principle of evaporation, it can give us the importance, or in the pathophysiology, that this principle can help us to best explain of what is happening in the body, of why the person could lead to dehydration. Okay, next, growth. The growth itself is a principle wherein it will give us the idea of the increase in size of all parts of organism. Di ba, sir, you may imagine from the embryo to the young person to the adult, how it happened. In pathophysiology, this may cause the possibility in the future that there is a problem with the growth of the person, simply because there are underlying factors. It could be the possibility of the development or premature development of the bone. There could be a possibility also of the storage of calcium, which is not which did not promoted to the development of strong bones. There could be a possibility also of the bone cells that are deprived from nutrients. So there are many factors that we can connect of underlying factors that may affect specifically in the increased size. Remember, class, from the infant, from embryo to the infant, as it increased the age, it increased also the size. Lalo na, for example, if the person, male or female, leads to the stage of puberty and hormonal production increases, there will be increased growth of hair, increased growth in the size of the breast. It could see also the change in the muscle contour. So those are expectations because of the hormonal response. Next is about development. We have been oriented from the growth and development includes the changes in the organism through time. We have already explained the response of a child from an elder as we compare its physiologic function. And this could be correlated on how the person responds to specific disease process. Differentiation. So, pag sinabi natin differentiation, this is the change in cell structure and function from generalized to specialized. Example, a while ago, we have discussed about the number one, which is the organization. Organized. From the term itself, organized. We can distinguish lung cells from pancreatic cells, from kidney cells to skin cells, and so on and so forth. But the differentiation itself is that of how these cells from generalized will be specialized from the distinct organ cells. So that's why from the term itself, differentiation is generalized to specialized. It started with the sperm cell that unites with the egg cell and becomes the zygote and embryo. And this zygote and embryo will determine now the distribution of cells to have specialized to identify nerves, for the blood, for the muscles, for the distinct bone development. So, yun yung tinatawag nating differentiation. Kaya class, when it comes to the development of the embryo, there could be a possibility na nagkukos tayo ng mga congenital diseases. And the congenital diseases is brought about by what? Factors that may affect pregnancy. And this may significantly affect the function of differentiation from the generalized to specialized. Kaya sometimes nagkakaroon tayo ng problem with the nervous system, problem with the skeletal, and moreover with other congenital problems with the heart. So, last but not the least of the 6 characteristics of life is reproduction. It is the formation of new cells or new organism. So, this is already the pathway that once the sperm, the male sperm and the female, the egg cell meet each other, becomes a zygote, embryo, and baby. Hindi pwedeng it start with the baby and ends up with the sperm and the egg cell. So, that particular orientation gives us the idea na okay, from the zygote itself, why is it that there are some instances na hindi siya nagde-develop ng embryo? Kasi there are underlying causes na mayroong problem with the pregnancy or the chances that the mother have history that may cause a possibility na yung embryo ay hindi nagde-develop. Meron tayo din tinatawag na ang pregnancy develop outside the uterus. So those are situations where it has underlying factors that may connect to the pathophysiology. Okay, I may not proceed anymore to homeostasis because it's already 7:30. So I will keep you updated of your DOLMS. For now, the assessment task will be scheduled for submission as you access the DOLMS this coming Wednesday and your enrollment as well. So I will stop the sharing and the record.